AED. You'll be familiarizing yourself with the AED device that you'll use today for your training class. There are some differences for the use of an AED for infants and children under 8. Some AEDs can deliver either an adult or child shock dose. The child dose is used in children under 8. If you're using a pediatric-capable AED, it will have features allowing a child-appropriate shock. But which feature is available depends on the type of AED you're using. Your AED may also include smaller-sized pads that are designed for children under 8 years of age. If it does, use them. If not, use the adult pads while making sure that they don't touch or overlap. However, you should never use the child pads for an adult. The shock dose delivered by child pads is too small for an adult and will likely not be successful. It's better to provide high-quality CPR than attempt to shock an adult victim with child pads. Some AED pads recommend a different pad placement for infants and children, placing one pad on the chest and one pad on the back. Follow the pictures on the pad packages for proper pad placement. Although AEDs may differ slightly, there are 4 universal steps for operation: turning on the AED, attaching the pads to the patient, analyzing the heart rhythm, and delivering a shock if indicated. To begin, turn on the AED. Just open the carrying case or the top of the unit and simply power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's chest by using the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the child's age, use the adult pads. You may also need to plug in the pads for certain models. Following the pictures found on the pads, attach the adhesive pads to the victim's bare chest. Place one pad on the child's upper right chest directly below the collarbone, and the other to the side of the left nipple.
Plug in pad.
After the AED is turned on, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm. The AED will deliver an audible prompt when it's ready to analyze the rhythm, followed by a prompt to clear the victim.
Analyzing rhythm. Do not touch the victim.
Clear.
The rescuer should strongly repeat the command to clear, checking visually to be sure that all rescuers and bystanders receive the command. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim.
Shock advised. Charging. Do not touch victim.
Clear.
The rescuer should again repeat the clear command to those nearby and visually confirm no one is touching the child, not even the person in charge of giving breaths. Then, the shock can be delivered.
Push the shock button now.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles.
Push the shock button now. Shock delivered. Resume chest compressions.
1, 2, 3, 4, 5. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED or turn it off. The device will repeat the analyze and shock cycle about every 2 minutes. Follow the voice prompts of the AED. If at any time the AED indicates no shock is advised, immediately start chest compressions. If the child has water on his or her chest, this can be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If someone is lying in water, you should quickly move the victim to a dry area. However, if the victim is lying on snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. We'll pause here to allow you to get familiar with the AED.